Hi everyone, this is Dr. Stefan. Welcome back to the channel. In this video, I'd like to talk a little bit about the difference between short-acting bronchodilators and long-acting bronchodilators. So I received a comment related to the difference between albuterol and long-acting inhalers such as Spiriva or Spiolto. Now, albuterol or Ventolin or salbutamol or the blue inhaler is something that looks like this. Most people who suffer with respiratory conditions have seen this inhaler before. So this is a short-acting inhaler. So it is a bronchodilator. Now, what is a bronchodilator? Basically, it's a medication that you inhale within the airways, and it relaxes the little tiny muscles around the small airways, and that gives you a bit more room to breathe because it tends to relax the airway, open it up a little bit. Now, that works quite well in a number of conditions, such as COPD, asthma, maybe others, in which there is a component of an airways disease. Now, that is good at relieving the breathlessness in the short term. So if you're taking something like this, a blue inhaler, it generally works for about 4 to 6 hours, then the effects wear off. Now, that can be enough, for example, if you're suffering with asthma and you're having a very mild attack, and that just relieves your breathlessness, the attack goes away, you don't need it again. However, in some conditions such as COPD, you tend to have a chronic obstruction within the airways. So there's a bit of a blockage. The airway seems to be a bit more constricted for a longer period of time. So you may be breathless throughout the day. So in those situations, being on a long-acting inhaler is actually a bit better for you because you don't have to take it every 4 to 6 hours to maintain a level of comfort in terms of your symptoms. Now, things like Spiriva and Spiolto, these are inhalers that can act for up to 24 hours. So obviously you can just take it once a day, and there's a number of other inhalers that have a similar effect. There's quite a lot of options to choose from, and just finding the right device for you together with your doctor can be quite beneficial. So this is basically the main difference. That albuterol is a short-acting, quick-acting inhaler, whereas the others are long-acting, but a bit slower in their onset. So one like this would be used for short-term control, treating an asthma attack, treating an attack of breathlessness, whereas the longer-acting ones would be for long-term control. So they take them as you would take, for example, high blood pressure medication. You may take them once daily or twice daily as recommended by your doctor. So this is the main difference between these types of bronchodilators, medications that dilate the airways. Now, I haven't touched upon steroid inhalers. So steroid inhalers are inhalers that contain corticosteroids that you inhale within the airways. These are very useful for the treatment of asthma because asthma is mainly an inflammatory condition affecting the airways. So that's what's causing the asthma attack. It's that inflammation that leads to more mucus in the airways, spasms of the little muscles around the airways. There's irritation, inflammation in the airways. Inhaling this anti-inflammatory drug, the inhaled corticosteroid, tends to control that inflammation and gives a chance to the airway, and this is a bit of a misnomer, but as a simple explanation, it gives the airway a chance to heal itself. So when that happens, you tend to have fewer asthma attacks, you tend to need less of the inhaler. So this is very interesting because it's a different type of condition that's treated in a different way. So in this situation, you may have to start a bit more aggressively with higher doses of inhaler, of this inhaled corticosteroid. But then as the asthma becomes more controlled, your doctor may see you again after 3 to 6 months and decide or recommend to you that you may try a lower dose. So this can be a step down or step up in treatment depending on your needs. Now, sometimes you need a combination, so basically an inhaled corticosteroid and a bronchodilator, and these can sometimes be included in the same inhaler. So for example, something like this, which is a Foster inhaler, there are others as well, so I'm just having these two here by my desk, but these contain, for example, 2 medications. They contain an inhaled corticosteroid and the bronchodilator, long-acting. So not like this one that only acts for maybe 4 to 6 hours. This one may act for up to, for example, 12 hours. There are others that can act for up to 24 hours, and they can be mixed together in the same inhaler so that you're getting both medications at once to have a synergistic effect. So you are combating the inflammation in the airways if you're suffering with asthma, but at the same time, dilating the airways, relaxing those little muscles to help you breathe better. So it's a combination inhaler. Now, nowadays, there are things like Trimbo or Trelegy or others that contain 3 medications inside. So the inhalers have become very, very complicated these days because it actually helps to treat as many of the components of the airways condition as possible in one go. It makes it easier for patients to just take one inhaler rather than 1, 2, 3. So it becomes a little bit easier to treat things in that way. Now, the triple combination inhalers, basically they contain the inhaled corticosteroid and 2 different bronchodilators. So when you have 2 different bronchodilators that act in slightly different ways pharmacologically, you tend to have a synergistic effect. So you have a better control of that airways component. So the airways stay dilated longer, but you're also treating the inflammation. So this is where things are going nowadays to make it a little bit easier for patients. Now, triple combinations are not for everyone, and that's the nuanced part of this video. And I hope I haven't lost anyone on the way in this video, because basically if you're treating an airways component, you don't necessarily need to start with the best, most expensive, newest inhaler on the market. You need to start with a treatment that's tailored for your case. And your doctor may help you decide a lot which inhaler to use. This can be because of cost considerations. It can be due to the device design. So some devices are easier to use than others, and not everyone is the same. Some people have different skills on using different inhalers. So for example, this is a puffer. This releases a little bit of a spray. Now, there are others that, for example, contain a dry powder inside. So you inhale the powder, you move the powder yourself. It depends from person to person. So having good inhaler technique is really important, and just being on the right device for you. Then the option of going on 1 inhaled medication, 2 inhaled medications, 3 inhaled medications, it depends on your situation. So how severe your condition is, for example, or how well you respond to 1 simple inhalers. For example, you may start with a simple inhaler, and then your doctor may decide, well, this is not enough, let's try to add something else. There's lots of consideration. The great news is, though, that you have so many options in terms of inhalers on the market. When I started doing pulmonology, I don't know, probably 10 years ago, so that's when I started training in this field, we only had a handful of inhalers, and within 10 years, we have so many options. And this is great, because if you keep going to seeing your doctor, to getting regular checkups and follow-ups, you can actually find what works for you. And if you're getting, for example, side effects from one of the inhalers, you can cycle to a different type of inhaler, go back to another one later on. So there's a lot more flexibility in terms of treatment. And they are quite effective. And the main thing that I wanted to mention before I end the video is that inhalers are inherently quite safe medications, because you're inhaling very little amounts of medication. So it doesn't tend to get absorbed in the rest of the body. So this means that if you do have side effects, they tend to be, small things that you can manage. So it could be related to a bit of a hoarse voice, potentially getting a little bit of a fungal infection in your mouth that can be treated. Sometimes that can happen if you're not using the right technique, or there's an issue with the inhalation, or the powder staying in the back of your throat. There's lots of things that can happen potentially with inhalers, but they're usually mild. The side effects are mild. So I won't drone on more in this video. I hope this was helpful. So just to conclude, the difference between a short-acting inhaler such as albuterol and a long-acting inhaler is really the duration of action and how quickly the onset is. Because for something like this, it'll be quicker. For something like this, like a long-acting bronchodilator, you may have a slower onset. So it depends on what you're trying to achieve. Are you trying to treat an asthma attack, or are you trying to basically control a condition long term? But this is where it gets a little bit tricky. Sorry, I just mentioned this one as well, and then I'll finish. So some long-acting bronchodilators that are contained, for example, in Foster and Symbicort, they also act very quickly. So sometimes they can be used as relievers as well. So to treat an attack, for example. But that's, I've talked about this in other videos as well. So feel free to search my channel, and you'll find probably a lot of information on various types of inhalers and how they are used. Thank you very much for watching. And if you have further questions, leave them in the comment section below. I'll try to come back and do more videos on this channel. I've been focusing a bit more, like I said, on the other one, interstitial lung disease info, which is a different niche field of pulmonology. But I try to come back and do videos on both. Thank you very much. All the best. Good health.